And I started this about 1976, Takshashila University. So it's been doing training and courses. For the first 30 years, it did technical courses, but then we added health. So School of Integrated Medicine, when we started, we tried to combine different therapeutic modalities. Particularly, I was interested in making sure that yoga therapy is included and Ayurveda, they go together hand in hand. And other modalities also. We have professors of doing acupuncture, and she is not here, but one of these days we do. We have somebody doing Reiki, somebody doing energy healing. So they are all there, but slowly we'll bring them on. But right now, Dr. Dilip Sarkar is the right person to do, because he's not only an MD, but trained in Ayurveda, and also he's certified, and also in yoga therapy. So he is the chairman of the School of Integrated Medicine of Takshashila University. And so we have a very good turnout. Thank you for coming for the 6th Yoga Therapy Retreat. We do that once a year, at least in this part. We'll do one in California also, because we have another office there. And then Dr. Shravana Chakrabarti is right there. He's another MD. And then Dr. Vardhan will be coming later. He's also, so they have 3 MDs, and one, our Dr. Abha Gupta is here, and she is a teacher, trainer, weekly. All of them are volunteer trainers, by the way, and we do, you probably get the notices. Now, just a quick, some people may question, what is Takshashila University? I just took the name from one of the oldest universities in the world. That was 900 BC to 540 when it was destroyed by the invaders coming from the northwest of India. It's located, exact location is now in what's called Pakistan, but originally it was Greater India. So it changed its various functions. It had 10,000 students. 2 out of 3 were rejected applicants. And there were almost, people came from all over the world. There are 2,000 faculty. So look at the ratio, 1 to 5. And so they were master teachers, and they taught everything. How many subjects? 64 subjects, out of which 18 were arts, humanities, including the art of wooing. That was one of the, because the king's sons used to come and they needed to learn all these arts. That's just a short history, and I took the name because one of the visions of Takshashila University was respect for the teacher, and they were really disciplined, and also unfettered thinking. There was no constraint. The moment you bring constraint, creativity becomes mechanics. And that's what the definition of creativity is, unfettered thinking. And that's why they could develop the famous grammar at that location, which is the Sanskrit grammar, with 2,900 rules. And also Ayurveda, the person Charaka, who developed the first herbology book, Charaka Samhita. And also Chanakya, who developed the Shastra for statecraft. They were all developed in Takshashila University. Many of the teachers that you hear about, the Greeks, Chinese, they all came to study there. The degree in medicine was 7 years. And the famous story goes that when Charaka was given the task, his teacher said, here's a spade, go and find me a tree. Plant which has no medicinal value. So he went around for 3 months. He came back, he said, sorry, I can't find a plant with no medicinal value. He got a degree. So that's how he graduated. Anyway, that's a small introduction. But now we are here in the modern world. So we have changed our subjects, our topics, and we'll let now, taking that much time for introduction, I'd like to invite, there's a little procedure we do. And either Abha, Dr. Gupta will do it, or Dilip?
No, what it is, in a yogic tradition, we do the invocation, first lighting called a diya, or a candle. Because of fire regulations, we cannot do it here. Next we do the chanting, then we start with the blowing of the conch shell. So Avagupta will do that for the chanting and the blowing of the conch shell.
Yogena cetasya padena vacham malam sharirasya ca vaidyakena yopakarotam pravaram muninam patanjali prananjali ranatosmi. This is an invocation to Patanjali, who presented to the world yoga for the mind, grammar for the speech, and Ayurveda for the body. And I salute Patanjali.
That is what pranayama is, That's what we've been practicing. Tell you one thing, it is not easy. Try doing it. I guarantee you, most of you will be able to do it. Anybody here can blow a conch shell? Anybody try? Try, you'll see how easy it is. Okay. Happy Valentine's Day. We had a Valentine's Day yesterday, and also this is the month of, this is the heart month. Let's see, this thing is just ridiculous. February is the heart month. Most of you probably know by now. So we thought we'll do a little retreat for heart health. Very interesting thing is, yesterday I was in Eastern Shore, Salisbury, Maryland, giving a talk on clinical application of yoga for the treatment of the cardiac risk factors. What you know about risk factors of the heart disease, the traditional one, diabetes, hypertension, your high cholesterol, truncal obesity, yoga believes they're all together. They're all called metabolic syndrome, and it comes like chicken comes first or egg comes first. You have diabetes today, you have heart disease tomorrow, you have heart disease today, you have high cholesterol tomorrow. And the reason is, yoga believes that this is due to called hyperarousal of our mind and brain. What does it mean? It is due to insomnia and sleep apnea, and also what we call stress. The effect you see here, it is the outcome of that risk factor, what we are carrying it all the time with us. In the United States, you have no idea how many people have insomnia. That's the number of heart disease we get here. When the cardiologist looks at a person who has an acute heart attack, everything is normal. There is no cardiac risk factors. Cholesterol is normal, blood pressure is normal, they've been exercising, they've been bleeding right. Perfect, everything looks like a book, but still they have a heart disease. We have a couple of people, including myself, and a couple of friends here in the audience, I know, we're in the same boat. But if you look at it, it's called hyperarousal of the brain. Snoring. Snoring is the marker for sleep apnea. So we'll talk about all this stuff. I have given you the whole handout. Handout has actually, we gave you all the handouts, so you have all the information with you for your future reference. We'll just skim a little bit through there. We'll throw the practice which you're here for. We'll do more on practice and less of talking. So this is our agenda, which you have already, and we'll try to follow the time. And I'm going to go a little briefly for you before we start doing about 15-20 minutes. If the yoga at this time is regarded as a preventive medicine, it is called primary prevention. My father has a heart disease, my mother has a diabetes, I'm going to get because genetically predisposed. Genetic predisposition does not cause a disease. It's called genetic expression. Gene has to express, and that gene can be suppressed. Metaphorically, gene is like a light bulb, and the switch is in your hand. You can turn it on, turn it off. Yoga will turn it off. Preventive medicine. Curative medicine, therapeutic. You have a heart disease, you get angioplasty, bypass, or you get your CD calcium score, your calcium score above 400, you know you're in a high risk for heart disease, or you have heart disease, it will prevent progression and reverse the disease. But fundamentally, the most important part of the yoga is called supportive or rehabilitation. It's a better management of the disease, less pharmaceutical dependency, better quality of life. Can you imagine the pharmaceutical dependency? I just saw a man get hepatitis C. You've heard of hepatitis C? Sure. He takes a pill for hepatitis C. Each pill costs $1,000. I had absolutely no idea why a pill can cost $1,000, but that's his taking. And most of the people, even people smoking, nicotine, alcohol, everything goes away. People with the antihypertensive medication, diabetic medication, this all goes away. So these are the things you already know. All of your avid yoga practitioners here. It's therapy. It's a controls stress, increases feeling of compassion. But most important thing is the way yoga controls your heart disease, you stay calm in the middle of crisis. Meditation is medication. That's where the yoga therapy works. Yoga therapy works through a meditation. To reach the meditation, you have to do proper relaxation of the physical body. You have to do effortless breathing, calm your mind. If you sit down for meditation, close your eyes, try to do your breathing, you will be nowhere because your mind will be wandered everywhere. So staying calm in the middle of crisis, which will be your absolutely effortless. Meditation, as I say all the time, is not sitting down, closing your eyes, following your breath. Meditation is when there's wind chill factor of 9 degrees outside, your car doesn't start, you don't have a proper attire, but you still stay calm in the middle of the crisis. That's what the meditation is. Yoga still has some component of exercise which lowers the risk of heart attack. Pranayama alone causes cardiovascular condition. Yoga believes that your lung and the heart is the same organ. Exercise your lung, your heart will get better. Yoga helps weight loss, is antidote to depression, and most fundamentally the way it works, because it increases vagal tone. What does vagal tone mean? Vagal is a nerve. We have a sympathetic and parasympathetic. It increases sympathetic and reduces sympathetic, increases parasympathetic function, but more than that what it does, it causes a rapid shift from sympathetic to parasympathetic. That means when I am in a fight and flight response, if a car is coming towards me, my blood pressure goes up, heart rate goes up, respiratory rate goes up, but it quickly can shift from parasympathetic activation, so there is a protection for your heart. Interestingly, the heart disease takes place because you have a plaque in the artery. calcium score. People are so concerned, I have a calcium score of 700, 800, what should I do? Nothing. You have something done, test done, now you think about yourself. That plaque is not going to cause any problem for you, but there will be a sudden change in hemodynamics, sudden change in the heart rate, sudden change in the blood pressure. In that situation, that plaque will rupture, called unstable plaque. That will close the artery, you will get a heart attack. So what does it mean? What does it mean you're playing a tennis? You get a heart attack. You're screaming at your spouse, you get a heart attack. Because emotional trauma is actually more than your physical trauma. What it does, yoga practice, it will shift you the parasympathetic activation. It will prevent you from sudden rise in the blood pressure and heart rate. The plaque rupture is not going to take place. Baroreceptor sensitivity, heart rate variability, these are the words we use for medical term, but basically means adaptation of my body. When I do a headstand, we show everybody, in my class, all of you come to my class, we have seen. Don't do headstand if you're 40. Don't do headstand if you have a heart disease. Don't do headstand if you have high blood pressure. You don't do anything. Keep your head down. Pressure inside the brain goes up. Pressure inside the eyes goes up. Pressure inside the neck goes up. What happens? You cannot breathe. You cannot talk. You're miserable. But if you keep your head down, body's baroreceptors comes in play. Intracranial pressure comes down. The pressure in the eye comes down, pressure in the carotid artery comes down, then your body will allow you to get your head down, feet high up. We talk about hemodynamics. When the blood pressure between the head and the leg is normal, body will allow you to build a headstand. Contrary to the belief, headstand does not increase your blood flow to the brain. Same way, I'm standing up. If you stand up for a long time, what will happen? On vasovagal attack, I fall down. What happened? All the blood is going through my leg, fall down, blood goes through my head, I wake up. Heart rate variability is a function of parasympathetic nervous system. So this is the concept of yogic, that these are all together. But primary problem is called truncal obesity. And these are called, if you look at a person who has a little bit of a pouch here, skinny arm, skinny leg, medical term, we call it a Cushing syndrome. Cushing syndrome means I have a high cortisol level. And cortisol is the hormone of stress. That's what yoga believes. The stress is the root cause of all the heart disease and all the heart health. These are all the conditions together. So a person who has a truncal obesity, they're not going to live long. Period. Person who doesn't have a straight spine, according to yogic tradition, they're not going to live long. If you look at somebody, 90 years, 100 years, they don't have any guts, the spine is straight. Very simple observation. Yogi's observation is called observational studies. It's called practice-based evidence. So what are your risk factors for heart disease according to yogic tradition? It's stress, fear of unknown. What I'm doing, I'm going to a mall, I don't know what will happen to me. I'm going to plane, or they're going to hit the World Trade Center. Whatever happens to me, fear of unknown. Insomnia and sleep apnea. Very important. It affects our emotional part of the brain called limbic system. What it does, the limbic system has areas called, these are not medical terms, supraortic and paraventricular nuclei. It sends a signal to hypothalamus, sends a pituitary gland, but it's a whole pathway which we know. But these are the root cause, which is controlled by yogic practice. So what are the practice? Stress is controlled through a relaxation of response. In yogic terms, it's called Sthitikaran Asana, and we'll be doing it more and more. Effortless yogic breathing. What is yogic breathing? Slower rate of breathing, exhalation longer than inhalation, and longer breath holding power. That's what you practice. The moment you practice, you'll be able to blow that conch shell. Very, very easy, and that will be there. You have a better heart coming down your mind through a savasana, yoga nidra, pranayama, meditation. Yoga believes very strongly about vibration. That's when all the mantras come in play. Our brain is in a state of vibration. You create a vibration from outside, and they cancel each other. It's called harmonic resonance. Very important concept. That's what you see. She started with the invocation mantra. But, you know, it's not the way the words, it's the way she was pronouncing. That is has a lot of calming and cooling effect. So, we'll do the truncal obesity, we'll do practicing on Mundukasana, you do frog pose, Kapalbhati Pranayama. Those are to control your truncal obesity. It's a very important concept. Stress, we'll go to meditation, is a treatment of stress. Insomnia, we'll do Bhramari Pranayama. We'll shut down all of our senses, we'll be practicing Vira Pranayama, we'll clear sound, let it be. It cancels. It puts you in a state of sleep. And we do it all the time. When you are all doing it, you know, half of you don't even know where you are. And for the sleep apnea, it's a Ujjayi Pranayama. It sends a signal to the brain. Brain sends a signal back to your tongue. Tongue goes in front. Very important concept. And most important thing, what really helps in heart health is called a daily routine, called Dinacharya. So we are not going to go over these things. We'll go to what does yoga means. Yoga means union of the body, mind, and spirit. And I tell you about the definition of yoga. I was so impressed. The present Prime Minister of India, he practices yoga all the time. So I think I told you the story. He had an interview here in CNN, and at the end of the interview, just 10 seconds, he said, Prime Minister, I heard you do yoga. Tell me why do you do yoga? He didn't say anything about all the benefits or anything of yoga. He said, you have 10 seconds. Normally, my body and mind is separated. Yoga puts my body and mind together, so I function as a good human being. 10 seconds answer, profound definition of yoga. I never heard it before, and impressed. So go over with that. Yoga is a philosophy, and this is the one thing we always like you to keep it in your body of mind. Body, mind, and spirit. Body is like a hardware, mind is a software, spirit is a program. Whatever you do to the hardware, whatever you do angioplasty, bypass, medication is not going to work unless you fix the software. Software is very important in the mind. Who can fix the software? You can fix the software. So what is that? I am the cause and I am the cure. It's the Yoga Sutra we're talking about, Dr. Chakrabarti we're talking about, and the 8 limbs of yoga. We'll talk about this afternoon. And then we'll talk about all these yogic practices for the whole day. I'll show you Aruna Jalneti, I'll show you, all the kriyas, the bandhas, mudras, we have a whole day here. So this is very important statement for you to take. This is called practice-based evidence. What it does, yoga therapy is an adaptation. Every yoga practice, if you do yoga, you will have some health benefit. So what it is a yoga therapy means adaptation. What is adaptation? I cannot walk, or I have, 300 pounds, or I cannot sit down in a mat. I need to adapt. That's the way you are going to come in the place, how to adapt. It is transformative. The words we use for people who have a disease called rogi, it converts to called nirogi, then it converts to called yogi. In stages, impossible become possible. That's what happened. I think most of you know, I have open heart surgery, almost 15 years now, 14 years, 2001. So I was a rogi, disease. But with the practice of yoga, I overcome. I became a no disease, now I became yogi, now I do everything, nothing bothers me. I wake up in the morning, one morning I was get up, I said, today I'm going to take it easy, I'm not going to do yoga this morning. I really don't know. Slowly I go there, by the time I do my regular yoga practice. It's so addictive. It doesn't matter, I'm in a train, I'm in a plane, I'm in a hotel, I have never missed. I don't know when the last time I missed yoga. We'll talk about, this is called 1 hour of practice. 25 minutes of asanas, 25 minutes of pranayamas, 10 minutes of meditation. That's what will give you all the benefits. And these are the pranayamas we'll practice at the end of the day, pranayama and the meditation. We talk about it's a preventive medicine, primary prevention, secondary prevention, rehabilitation, very important. Better management of the disease, less pharmaceutical support, better quality of life. So we'll do more and more that all these cardiovascular disease, what you're going to practice, we'll be practicing this, we have all of them. The way we'll start with a relaxation response. So we're going to start, we have a lot of pictures here, I don't think I showed you the pictures. I'll go, if you can sit down, it's good. If you sit down in a chair, it'll be good. So I will just ask Dr. Chakravarti and Abha to come to the stage. I will be also sitting in a chair and also getting down into the mat, so go back and forth. And just to give you a little bit, if you want to give a preview, just a couple of minutes, what you're going to do it here, we'll be doing relaxation of the hand, feet, knees, hips, joints together. Very slowly we'll do relaxation of all the smaller joints. And then the way we'll do it, I'm going to go over very quickly, then we'll show you the pictures again when you do it. We start with the toes, we'll do a Chakri Chalanasana, we do this is called Soni Chakra, or hip moving. This is your Tidhyasana, this is for your Brahma Mudra, this is for your hands, or Adi Mudras, this is called Skanda Chalanasana. This is for the neck, so about 4 positions of the neck we'll do. Then we'll do all the balancing poses, very important balancing poses. We'll do upward mountain pose, triangle pose, seated for Paschim Namaskar, very important chest opening poses. Tree pose, Natarajasana, Virabhadrasana 3, Vajrasana, Matsasana, Yog Nidra, and we'll go to the moon salutation and the asanas specifically for your cardiovascular disorders. This morning we'll do asanas, and afternoon we'll do the pranayamas and meditations. Most of you have seen all the asanas, but one most important thing to do, able to stay in the asanas for a long period of time. Initially, it starts your contracting your muscles, and slowly it starts relaxing. So the first component of relaxation is called Sthiram Sukham Asana. What does Sthiram Sukham Asana mean? Sthiram means stillness. Wherever you sit down, you have to be still. Sukham, you are happy. Asana, poses. So all the practical purpose of yoga for your heart disease to keep your body relaxed and calm mind, Sthiram Sukham Asana. Second component is your spine strength. Wherever you sit down, in a chair or in the mat, keep your spine straight. What is the concept of straight spine? Concept of straight spine is I'm standing here with all my skeleton, muscles in the back, keeping me straight high up. If I let the muscle relax, keep my spine straight. So all of you sit down on a mat, on a chair. If you sit in a chair, what you do is sit in the front of the chair, you go all the way to the back and keep your spine straight and stay there 24/7. That's where you eat, that's where you drive. Next, my mind controls my hand. So every time I'm talking, I'm moving my hand. So what we'll do, you will do a hand gesture mudra. So you touch your index finger and thumb, put gently over both the knees. Second component. Third component will be your controlling your 5 senses. In yoga it says pratyahara. What is pratyahara is, first we hear, we see, we smell, we taste and we touch. Powerful of all of them is your vision. So what you do with the vision, close your eyes. Spine straight, Dhyana Mudra, close your eyes. Now you pay attention to breath. Breath is the connector between your body and mind. Close your eyes, visualize your breath, and slowly bring your awareness to your breath. Lung is like a balloon. It has a 4-liter capacity. We only breathe 500 cc. So you should learn how to breathe out longer than breathing in. So what you do first in a yogic tradition, you learn how to breathe out. Then you'll be breathing in slowly, actively, inhalation with a, say, 2 seconds in, 1 and 2 in. The lung has expanded. Now you just let go. Passive exhalation, at least twice the level of inhalation or longer than inhalation. Close your eyes and let's do it about 5 times on your own pace. But bring the rhythm back. Feel like home. This mat is your home. Completely relax, spine straight, eyes closed, touching your index finger and a thumb, and 5 times breathing out longer than breathing in effortlessly. Fifth component is the vibration. What the vibration does, again, that our brain is in a state of vibration, and our yoga gave us vibration sound of Om. Om has 3 components, A-U-M, Sanskrit you say A-U-Ma. It also connects with called a yogic breathing. Many of you know, because some of you are very experienced yoga practitioner, called Dirgha Shas. 3 stages. Lung has 3 lobes, lower part, middle part, and upper part. So A is an out breath, comes from the lower part of the lung, U comes from the middle part, M comes from the upper part. So you will do 3 yogic Om. You will breathe out first. You will take a breath in and breathe out the sound of Om. Again, keep your spine straight, eyes closed, touch your index finger and a thumb. Pay attention to your breath. Breathe out first. Take a deep breath in. Open your eyes slowly, rub your hands together. Very good yogic gesture. When you feel the warmth in your hand, you put it over your eyes. Let the eyes take the heat from your hand. Then massage your forehead, massage your eyes, massage your face and head and neck. This is called rubbing and cupping, it's almost guaranteed that your vision will get better. Relaxation of the eyes changes the shape of the eyes. It relaxes your lenses, relaxes your called ciliary muscles. A lot of people have their reading glass get removed. So after that, first you start with your foot first. Get into the Dandasana, put your feet in the front. Get your body at a 90 degree, hands on both sides, and you start relaxing your smaller joints. The first is your toes. So separate your toes, breathe in and breathe out. With your breathing, breathe in, breathe out. Keep on doing it a few times. You have all of them in your handouts, so you'll have no problem. Called Pada Mushtika Asana. Separate your toes with breathing. This is the market is full of it. I can see here, yoga toes, yoga socks, yoga shoes, all separation of the toes. If you can do that, your pain in the foot will go away. Plantar fasciitis, bunion, hammer toes. Next is your foot rotation. You put it there, and then with the breathing, you rotate your feet. Sanskrit called Pada Chalan Asana. But you breathe in the middle, then slowly rotate your feet. Then we'll do your ankles. You do the ankles, breathe in, breathe out. You'll do your ankles with your breathing, and remember the relaxation of the ankles. Breathe in, breathe out. Breathe in, breathe out. Relaxation of the ankles will give your physical independence. Then you rotate. Breathe in, rotate your ankle. These are also part of called Pada Chalan Asana. Feet rotating pose. Then you do call it Chakki Chalan Asana. As called it mills grinding, churning. Put your hands together, breathe in. Breathe out, slowly come down as far as you can and go high up with your breathing. Breathe in, breathe out. So let's do it 5 times on one side and 5 times on the other side. Again, do it on your own pace. Best way to do it, close your eyes to the opposite side and pay attention to your breath. If you think yoga is a practice with awareness and with our paying attention to our breaths. We have our yoga teacher here, Dr. Topali, and he's going to guide you if you have any problem doing these poses, and just he will see you and draw attention for him. He's one of our pain physicians, takes care of all of us. Next you do called Sroni Chakra, a hip rotation and knee rotation. Take your one foot on the top. Now for the toe separation, you take your hand and put it in between your toes, separate your toes. How easy it is. More and more toes get separated, better and better relaxed you'll get. You heard the story, my story that I told this pulmonary physician, lung specialist? You heard my story before. Said if you learn how to separate your toes, your breathing gets better. He was so upset with me, he just turned around and left. He didn't even talk to me. 2 days later he comes back. He says, you tell me, why did you tell me if you can separate your toes, your breathing gets better? I said, the breathing is both conscious and subconscious. When you pay attention to your body, that you can separate your toes. Body is going to work for you. You're going to pay attention to your breath. You're going to do a better breathing. He said, yeah, makes sense. You can rotate your ankle and like this. Relaxation. Very, very important concept. Then you hold your knee, bring it up, breathe in, and let it go down on its own. You don't push it down. If you push it down, what will happen? It will recoil back. But if you keep doing your breathing, breathing out longer than breathing in, remember, breath controls your body and mind. I cannot do it. My mind cannot do it. Breathe in, breathe out. Anybody say, he is more flexible than me. She is more. My body is so tight. It is your mind is flexible, your mind is tight. When can I be able to do it? When you let go. Yoga is a balance. Health is defined as a balance of your body, mind and spirit. So do equally on both sides. Again, you can take your hands, separate your toes. Yoga said a very simple thing. Your body has to work for you. It's not that you are going to work for the body. Your body controls you through reflexes. You know what yogis did? They do all a procedure called kriyas. They control their own body. They control the autonomic nervous system. Breathe in. They don't want autonomic nervous system control them. They control their autonomic nervous system. Very important concept. A lot of names, Sanskrit names for this one. It's called a Shrodi Chakra. I heard it's also called, what is the Hindi of use? Kula? Kula Chalanasana, somebody told me. Kula is Hindi? Yoga is written in Sanskrit. Closest language to Sanskrit is Hindi, which Abha knows better. I asked Adarsh Deepak, who's supposed to know Hindi, but Hindi was as good as my Hindi, He started translating in Hindi to me. Very, very interesting language, powerful language. So I said the Hindi hip joint is called Kulla. Chalan is moving. The real Sanskrit word is called Shrodi Chakra. You do the Titliasana, Baddha Konasana first. You put your cobbler pose, bring it back close to put your hands under and slowly you do your butterfly. This is called Sanskrit called Titliasana. It relaxes your hip joint, very important for your heart health. Yoga believes the hip joint is the site of emotions. It's a wake-up call for all of us. All right. Well, you see, yogis and yoginis, they come in the middle of crisis. It's very nice. Then you are able to sit down in a cross-legged position. This is called Sukhasana. In a Sukhasana, you put your feet under your knees and able to sit down very comfortably. If your knees are high up here, stay high up here. What you need to do, spine straight, eyes closed, Dhyana Mudra, you'll say slowly and slowly, this thing is going to happen on your own. Again, you don't compete with anybody, you progress. So what is the next step? It's called your Siddhasana. Take your heel all the way to the back. You take the other foot on the top, and your knees drop down on its own. You really don't make any move. It comes to you. You progress a little bit more. You progress, put your one foot on the top. This is your Ardha Padmasana or Swastikasana. When swastika asana becomes very comfortable and stable, you get into Padmasana, right? Your lotus pose. This is the yogic pose. Relaxation of the knee joint, hip joint, back. Profound sense of relaxation. You have a knee problem, hip problem, back problem, big deal. Know why? All the tension you have been holding on, it is melting in this position. Initially, remember, the 3 stages. First is called Arambha, beginning. Beginning, muscle contracts, ligaments are all tight. But the moment you keep on doing the breathing, it becomes next to called Sthiti, stillness. It is called Visarjana, surrender. So you have done on the lower part of the body, now you do an upper part. In the upper part of the body, what you do, you start with the hands. If you say infant, how the infant closes the hand. But Bala Mushti Mudra. Bala means baby, Mushti means fist. Take the thumb inside and close. This is 24/7. Thumb inside and close. This is also called the Adhi Mudra. According to yogic tradition, there are 3 mudras in the hand which helps your breathing. The way you touch your index finger and thumb with the palm high up, this is called Dhanu Mudra, Gyanu Mudra, a lot of names there, but this is a meditation mudra. If you put your hand down with the same touching, this is called Chin Mudra. This opens up lower part of your lung. If you take the hands that bend all the fingers, this is called Chinmaya Mudra. This opens the middle part of the lung. Then finally, if you take the thumb inside and close, this is called Adhi Mudra, opens the upper part of the lung. So for the hands you do, you put your hands in front with the breathing. Breathe in. Breathe out, close your hands like an Adhi Mudra. Breathe in, breathe out. Then you can put your hands, rotate slowly, the rotation. A lot of things you can do. You can hold your hand, rotate like this. Also you can do on your feet, on your knees. You can do all sorts of rotations are relaxation. For the wrist, Mani Bandha Naman, wrist moving, wrist is Mani Bandha. This is the relaxation of the wrist. This is the tightness of the wrist. So breathe in, breathe out. One very important thing you need to know, when do you breathe in? You breathe in before a muscle works. So oxygen gets in. So breathe in and breathe out. You also can do like hands like this. This is a very good relaxation of the wrist. This is relaxation of the elbows, relaxation of your shoulder. And next what you do is called Paschim Namaskar. If you can do this prayer pose in the back, what you will do, you put your hands to the back, wherever it is, then you turn your hand in like a prayer pose, and slowly will get high up and stay in a prayer pose. This will relax your wrist, relax your elbows, relax your shoulder, pain in the wrist, carpal tunnel, elbow, tennis elbow, rotator cuff tear, all are going to go away. But most powerful concept of yoga therapy is able to stay in this pose. Paschim Namaskar. Paschim is the back, Namaskar is the prayer pose. Then come to the shoulder, you will do rotation of the shoulders with your breathing. Breathe in. You feel like there is a pencil in your shoulder, making a circle out of it. And just move your shoulder. You can do all this, sitting in a chair, do it 24/7. Remember one thing, you have to do yoga in an empty stomach in the morning. So many people comes to me and says, I need to have a cup of tea, I need to have a little biscuit. I said, please go ahead and have it. Breathe in, go backwards now. What will happen if you don't take what you're taking in the morning? Yoga is awareness. Yoga is a follow with your breath. What will happen to your awareness will be towards that cup of tea or a little biscuit you have been not taking it in the morning. You've been thinking about it. Take it. It's the full meal which really concerns. If you have a full meal, you don't want that. Skandha Chalanasana, Skandha is a shoulder, Chalan is a movement. Breathe in, breathe out. Breathe in here and breathe out. If you cannot make the big circle, you do it whatever, you have your eyes closed, you do it even halfway, it's good enough. Remember, you are not competing with anybody, you are competing against yourself. Different level. Level 1, level 2, level 3, we call level, stages, everything. You do it. Breathe in to the opposite side again. Keep on doing it. Do it about maybe 5 times on each side. That is more important. Then you hold your wrist. Left wrist on the top, breathe in, breathe out, pull it down, and the same breathing cycle, let it come back in the top. Breathe in and breathe out. So as a yoga therapist you do, close your eyes and follow your breath. Do it about 5 times on your own, on each side. With your breath, you breathe in the middle. When you go on the side, you'll go like this. Whole cycle of breathing out, coming down and get higher. Most tightest part of the body, which is your neck. All the stress, remember stress is your risk factors for your heart disease, diabetes, hypertension, truncal and the truncal obesity. Stress will tighten up this muscle. This is called a trapezius muscle. Stress will tighten up all the neck muscles. Brahma Mudra. Brahma is the name of the Supreme Being. Mudra is a gesture, the gesture of the Supreme Being. 4 positions to do with your breathing. Breathe in, drop your neck to the back. Breathe out, slowly drop in the front. Listen to your body's signal. No pain and effortless breathing. If it hurts, if it bothers you, you back off. But stay here. So let's do it 5 times. Breathe in, drop your neck to the back. Breathe out, slowly drop in the front. The moment you learn how to relax your neck muscles, rest of the body will get totally relaxed. Relaxation of the physical body, effortless breathing, calm mind, is the treatment of heart disease or coronary artery disease. Another important thing is that treatment is your daily routine. Breathe in the middle, drop your neck on one side, and same breathing cycle, come back in the middle. Close your eyes so you don't know who is doing what, to the opposite side. When you close your eyes, you can visualize your body, which is called a subtle body. We have three bodies: gross body, subtle body, and a causal body. This afternoon, Dr. Abha Gupta will be telling you all about the yogic anatomies. We say do 5 times on each side, and in a true yoga practice, you have no idea how many times you are doing. You have no idea even how you are counting. If you still can count and do a yoga practice, you are not doing a yoga practice. In yoga practice, your total awareness is in your subtle body. Total awareness is in your breath. If your awareness is counting how many times you are doing, your mind is still in a state of vritti. Yoga is defined as a chitta vritti nirodha, controlling the chattering of your mind. Third one, breathe in, look all the way to the back without turning your head. You slowly come back in the middle, breathe in, look all the way to the back. So again, do it 5 times on each side. Drop your neck in the front. You breathe in, slowly turn your neck to the left, to the back, to the right, and in the front. Again, do it 5 times, starting on the left side, and do 5 times, starting on the right side. Very gently, with your eyes closed, paying attention to your breath. Okay. Now we have relaxed all the smaller joints in the lower part, all the smaller joints in the upper part, in the upper neck. For the chest relaxation, you have done already before. It's called Paschim Namaskar. When you do a prayer pose to the back, it opens up your chest opening poses. For the back, in the lower lumbar area relax, it's called Yog Mudra. You hold your left wrist to the back, put your whole body high up, take a straight look, take a deep breath in, as the body goes on its own. You don't do anything, let the relaxation take you down. Find the spot where you have no pain, and you can breathe effortlessly. The way you test your effortless breathing is able to talk. If you can able to talk, that is good enough. You don't need to sing. If you can come all the way down and find your spot, stay here. Now pay attention to your breath. You breathe in with a count of 3 in and count of 6 out. See if you can breathe in at least 5 times in this position. So this will be your Sthiram Sukham Asana. Very important concept. Stay in the without a effort. This is the when you get up, you also do it very slowly. So you do 1 vertebra at a time, or you can do 25%, wait a little bit, 50%, wait a little bit, 75%, wait a little bit, then go all the way higher. For the heart health, we have been telling you, practicing you all the time, called sit, rise, test. You'll be able to get up without a support. I made a lot of fun on that. I said, if you can do that, you cancel your deposit to the nursing home. You cancel your premium for the long-term care. But people are accepting it. Cleveland Clinic is using it. Yesterday or day before yesterday, if you have seen all the news media, ABC, CBS, have published a paper, that they're writing about a paper. There's a paper being published from Brazil and published in the European Journal of Preventive Cardiology. This man looked at 2,000 patients. When you can sit down with your, call it Malasana, sitting pose, he gives the 5 points. If you can get up, 5 points, 10 points. If you cannot get up and use a support, if you use your one hand, takes out 1 point. If you take your forearm, takes out 2 points. If you take your knees, gets out 3 points. If you get your one side, takes out 4 points. Out of 10 points, then if you cannot get your balance, it takes out 5 points. 8 to 10 is great. And if you between 3 to 5, your chance of mortality from a heart disease is 6.5 times more than normal. Unbelievable. We have been practicing it. I'm sure all of you have practiced in my class. We've been doing it, and it's a large-scale study. And here comes conventional medicine, a cardiologist from Cleveland Clinic. I'm using it, but I don't trust it. It's good. So why are you trusting it? You know what the word they use? I love that word they use. They use the word called observational studies. But you know, in conventional medicine, do it all the time. We look at 3,000 patients. What they have done, write a paper. So see if you can sit down in a squatting pose, Malasana. You are halfway through your cardiac health. Very difficult initially, but if you can sit down, then if you are in a constrained time, look at how you can do. You can do all the, you can separate your finger, put your wrist, squeeze it. This is hands and wrist relaxation. For the knees, hips and back, you can put your one elbow inside, other elbow inside, squeeze it, put it together. Look at, this is called controlling your stress, controlling your heart disease, controlling diabetes, you name it. You can breathe, you can talk, then if you can say, get up. 10 points. Wow. So get to do a little better. So when you get better, how you do it? You cross your one feet. Then you can sit down. Then you can get up. Microphone is telling me that you're doing a good job, you know? Then you do balance your mind and the brain. What you'll be doing, you do opposite side. Balance opposite side, you can sit down, and you get up. A lot of people come and ask me, you know, we get all this information now for long-term nursing care. Should I get a long-term nursing care? I said, yes, if you cannot get up from the floor, you should, you know. So when you get up, first thing you do, called mountain pose, Tadasana. You put your feet together. Remember, it's all about your spine, especially the flexibility of your spine. You think about your ear, shoulder, hips and ankle in that same level. And also you can raise your hands high up. You'll be the same plane. If you do it against the wall, you'll be against the wall completely straight. Close your eyes, you breathe. Breathe in and out. Breathe out longer than breathing in. And see which every breath, your muscles will relax and you will be able to see your hand is going higher and higher and higher. It's amazing how you feel. The relaxation is reaching you. We said every time, you know, when you get mature, we shrink. But if you do yoga, you increase your length. Called spine lengthening. Spine lengthening is a concept of yoga. Put your hands down, cross your hands, put it on the head. Upward mountain pose. Utthita Tadasana with a balance. You breathe in. Breathe out, get into your tippy toes, and the hand goes all the way high. Upward mountain pose. Utthita Tadasana. Come down, one more time. Breathe in, breathe out. We're all talking about heart health here. These are the things you need to do daily. Slowly come down. Have your feet together. This helps a lot. You know, you're comfortable standing like this. But yoga said, you do go against the grain of your habit. It's the grain of your habit. Oblique mountain pose. Tirjak Tadasana. Breathe in, breathe out, go to one side. And same breathing cycle, come back in the middle. Breathe in, breathe out. One more time, breathe in, close your eyes. If you go all the way down, and same breathing cycle, come back in the middle. Every time you practice the yoga as a therapy, you ask the question within yourself, where is my breath? Where is my breath? Awareness to your breath. Hand on the side, Kati Chakrasana. You separate your feet, very simple, put your hands in the front, breathe in, breathe out, slowly turn your body all the way to the back, and then same breathing cycle, come back in the middle. Breathe in, breathe out. Close your eyes. You can easily visualize all your hands, fingers, and bodies. This is so powerful. Relax. This is called a moving meditation. Let's do it about 10 times, 5 times on each side. Eyes closed, and do with your own breathing, so you have no idea who is doing what. You are paying attention to your yoga practice, which is awareness to your body and effortless breathing. Question always in your mind, where is my breath? My breath is an in-breath before my muscle works, because in-breath brings the oxygen in. Breathe in the middle, breathe out all the way outside. If you go to China, you'll see this, Tai Chi, every morning. They're doing it. In fact, I was in India almost a whole month, going through a lot of yoga therapy centers, looking at them. I see a tremendous amount of this activity. This is called a moving meditation. Most of the people who are not senior, but mature, seasoned people do. Old is the word taken out from the Webster dictionary. Change. What is the oldest change name? What name there? The old is never been used anymore. Who is old? Nobody is old anymore. Okay, the one most important asana for a daily practice, especially for relaxation, is your Trikonasana. Triangle. So same way you are here, turn your one foot up, and then hands on both sides, and again, just let go. Touch your right hand to the right knee, look in your left hand, let the right hand do the walking. See where it comes down. If it comes all the way down, if your hand is in front of the foot, or hand is in the back, look in your left hand. In fact, you can even close your eyes, and you keep on doing breathing out longer than breathing in. In yoga therapy, it is able to stay in the pose. In Vini Yoga, Vinyasa Yoga, they get a flow. They get in and out through your breath. Ashtanga Yoga, you do all the power. In Iyengar Yoga, you just get into relaxation. Yoga therapy, you stay. Slowly come back high up. And the way, if you want to really count, turn your right foot in, stay between 5 to 10 breaths. 5 to 10 breaths is good enough. Opposite side, turn your left foot out. Again, touch your left hand, touch your left knee. You are not looking for alignment. You know, we have all these veteran yoga practitioners here, teachers here. Alignment will come to you. Your attention is pain and effortless breathing. If there is no pain, you have effortless breathing, you'll see the alignment will come to you. Stay here between 5 to 10 breaths. Then quiet down your mind. Make your breathing completely effortless. Tightness of the muscles of the breath prevents you from effortless breathing. Slowly come back high up. The next component is your balancing poses. What the balancing poses does, the mind. Remember the component, relaxed physical body, effortless breath, and your mind. Balance is all your mind. So the most important balance is put your feet together. And there is a chest opening pose for your heart patients or cardiac. So most important chest opening pose is your prayer pose to the back. The way to the prayer pose in the back, you put your hands to the back, you turn your hands slowly like a prayer pose, then you slowly get high up, depending on the timing and depending on your relaxation, it will go high up. Paschim Namaskar. Next you do, the most important balancing is, as yoga said, doing is the brain of your habit. I'm right-handed, right-footed. See if I can stand on my left foot. If I can stand on the left foot, it's not me doing it, my mind is doing it. And I know it very well because I can do one day very easily, another day I cannot do it. And when I can do it between 10 to 15 seconds, so I can close my eyes and do it. It becomes almost impossible initially, but this quiets down your mind. It controls your blood pressure, controls your heart rate, controls your respiratory rate. I'm still here. I'm still not being able to do. I practice it every day. Still it happens. So do the opposite side again. And somebody, will say one day is easier than the other day. Keep your feet high up again, and your eyes closed. I cannot do it, but mind cannot do it. It is a powerful control of your mind. Chest opening poses in yoga is regarded as the best treatment for heart disease. All, do Bhujangasana, the chest opening. So standing, we are very comfortable, putting our hands like this. So you see we do called Paschim Baddha Hastasana. You hold your one arm, take the other arm, put it to the back. Other thing you can do in the same position, the health, yogic health, heart health, also determine on the spinal flexibility. From here you can take a deep breath in, turn your neck all the way to the left, then slowly you can twist your whole body. You can separate your feet a little bit, it's easier. Then turn your whole lumbar area. This is the flexibility of your spine. Then bring your back slowly in the middle, then turn your neck in the middle. To the opposite side again, look into your right side, and this is the flexibility of your spine. More and more you're flexible, more and more you're relaxed. Come back slowly here. Your blood vessels will start relaxing. Peripheral resistance comes down. Blood supply to the coronary artery gets better. Then what you do, you also do balance to the opposite side. Now you hold the other hand. I'm holding my right hand. Let's see if I can find other hand. So you take it on the opposite, on the top. Same way, you can do one more time. You can do. Turn your neck to the left. So slowly twist your lumbar area back. Turn your lumbar area to the middle. Turn again to the neck to the one side. Lumbar area to the other side. Come back slowly in the middle. Dandayam and Gomukhasana. You stand up, take your one hand here, take the other hand, touch it, hook it. Essentially, you handshake each other. You cannot do it today, you'll be able to do it tomorrow. How can you do it tomorrow? You have to let go. Relax yourself. This thing is going to happen to you. Again, if you can doing a little breathing. Effortless breathing. I'm talking, that's why I'm having effortless breathing. To the opposite side. Other side, you go. Just, if you put your hand, stabilize your hand. Like, you take your elbow, stabilize. And what will happen once you stabilize? Then you put your hand there, you'll touch it, you'll hook it, you'll put it together. Now you'll notice that you are a little different than one side. One side is easier than the other. So what happened? It is a balance. When the balance comes back, both sides gets equally. That's the time you need. Dandayama, standing, Gomukhasana. Balancing poses, come back, release your hand. The precaution, triples. Take your one foot, you can take it way high up. Put your hands in the front. Remember, balancing pose is the most important of all the asanas for cardiac health because it controls your mind. You know, the mind is the heart. People doesn't believe it. You know, we use it in vocabulary, memorize by heart. Why do you call memorize by heart? Opposite side, we all know. We call memorize by heart because heart and mind is connected. Anything happens to your mind, it happens to your heart. So this is quieting your mind, quieting down your heart. Hyper-arousal of your mind is going away. Natarajasana, you can hold onto your one foot, your hand up, your hands go high up. Able to stay in the pose is more important. It's not how you can do it. The feet is not going high up today, it'll go high up tomorrow. So the opposite side. At home, what you do it a lot longer in each asanas. In fact, I tell people to do 25 minutes of asanas, do it about 8 to 10 asanas. They'll come and say, you know, I'm doing it about 5 or 6 asanas. I said, what happened? You cut down your time? I said, no. I get into asana when I don't know even how long I have done it. We'll do just a quick, your warrior series, because warrior gives you grounding. Another thing about the heart disease is, we call it the more you are grounded, you are better in your mind. So put your feet together, gently take your left foot to the back, turn your left foot in, and left knee is solid in the ground. So slowly bend your right knee. Don't let the knee go all the way down, it just stays above your ankle. And again, all the alignment will come to you. Virabhadrasana 1, put your hand in front, that hand goes high up. As if you're trying to get something from here. Virabhadrasana 2, hand goes on the side, that hand gets parallel to your body, and look at your right hand. Now comes your balancing pose, Virabhadrasana 3, warrior 3. Hand goes on both sides, the feet goes high up, and body drops down like an aeroplane. Now you know what is called stillness, sthiti. And this stillness will come, your heart disease will go away. Drop your feet down. Balance on the opposite side, right foot goes to the back. Again, you're turning in, then left knee slowly and slowly bends down. Put your hands in front, hand goes high up, hands on the side, turn around, take a look at it, and for the 3, hands in front, and the foot goes high up, and gets your body down. Drop it down. You're transforming, you now becoming, you are a rogi, you had a disease, you became a nirogi, you have a now we're going to do what is your, we are becoming healthy. So the first way you do healthy poses first is a set of sun salutation. Because Surya Namaskar. Surya Namaskar has 12 steps. You'll be doing it starting first, your hands in front in a prayer pose. You do it, we'll do 2 sets, we'll do 2 different breathing. You'll be starting the breathing in. Breathe out, hand goes to the back, Hastottanasana. Breathe in, comes in the front, hand touches the feet, Padahastasana. Breathe in, right foot goes to the back, all the pressure comes to the left knee, chest opens up, you look high up. Asya Sanchalanasana. Then your left foot goes to the back, heel on the ground, you look at your belly button, Parvatasana. Breathe out, slowly your knee goes to the floor, chin goes to the floor, then the whole body comes to the floor. Ashtanga Namaskar, touching 8 parts of your body, that's why it's called Ashtanga Namaskar. The body goes all the way down to the mat, breathe in, you get up into a Cobra pose, Bhujangasana. Breathe out, you go back to mountain pose, Parvatasana. Breathe in, right foot comes in the front, again pressure goes into the right knee, chest opens up, you look way higher. Breathe out, left foot comes in the front, hand on the both sides, head touching your knee, Padahastasana. Breathe in, hand goes all the way high up, Hastottanasana. Breathe out, hand is in the front, your Pranamasana. It also done with the mantras. Every asana has a mantras, and also the breathing. So next one we'll be using the opposite foot now. If the right foot is with the left foot, opposite breathing, because yoga is a balance. We'll start with the breathing out, and always do sun salutation in the air. And I will do a little bit of the chanting of the mantras when they're doing it. First, you put your hands in the front, breathe out. The word is called Om Mitraya Namah. Put your hands on the back, Hastanasana. Breathe in, called Om Ravyaya Namah. Hands down, Padahastasana, Om Suryaya Namah. This time the left foot will go back in, Anave Namah. The right foot will go in, and it'll put your mountain pose again, Agaya Namah. Then the Ashtanga Namaskar, body goes down, Pushne Namah. Then you go to the Bhujangasana, or Om Hiranyagarbhaya Namah. Go back to the mountain pose again, called Om Marichaya Namah. Then the left foot comes in front again, Om Adityaya Namah. Right foot comes to the front, hand side, Om Savitraya Namah. Hand goes all the way to the back, Om Arke Namah. The hand comes to the front, Om Vikraya Namah. So sit down now first. You'll be able to sit down in a Vajrasana. Vajrasana is a very important asana. If you need to do only one asana a day, you're able to sit down. And if you can sit down in Vajrasana, this is the spine alignment, supports your head, lot of anatomy behind it, and you're able to sit down comfortably. The first asana sitting down will be your Mandukasana. The yogic fist, hands on both sides, yogic fist at the level of your belly button, look straight high up, breathe in, go all the way down. As far as you can go down, again, you look straight high up, keep your head down, keep doing your breathing. Breathing in and breathing out. Stay there until slowly get up and able to sit down. This is Mandukasana. Very good for truncal obesity, very good for diabetes and obesity. This spare tire. This is going to kill you. No question about it. So you have to take care of this. Shashankasana, rabbit pose. Take the hands all the way high up. Like a rabbit, put all the way to the front. Get your head down to the ground, as far level as can go down, and able to stay in that pose. Breathing. Where is your breath? Your home. Where is your home? Your home is in your mat, and the breathing is you are paying attention to your breath. Able to stay is very important, then slowly get up on your own. We'll do part of your Gomukhasana. Gomukhasana is your very important sitting down pose. First you do it is called a Vaisasana. Vaisa means you put your one knee in the top of the other knee. This is so relaxing that you will be doing it every day, in and out. In fact, you'll be sitting like this in a chair, sitting like in a head. This is most relaxing of this. This is actually what do you call Vaisa? Buffaloes. Apparently buffaloes sit down like this, crossing the head. Right knee in the top, right hand goes high up, left hand goes to the back, touches, this is your Gomukhasana. Relaxation of your upper part of the body, lower part of the body. Amazing asana for relaxation of all the blood vessels. What happens, neuroplasticity. Muscle become relaxed, ligament become relaxed, slowly and slowly brain gets a signal, all the blood vessels get relaxed. Smooth muscles get relaxed. Opposite side, take your right foot. Sitting down asanas. Very important for relaxation. What we are practicing is called trying to relax our coronary arteries, trying to relax our peripheral arteries. Left knee, left hand goes high up now, right hand goes to the back, hand comes down. Again, I have rotator cuff tear, I have a shoulder arthritis, I have a neck issue, all this stuff, everything will go away. There is an issue called thoracic outlet syndrome. Wake up in the morning, your hand is numb. This will cure it. Cervical spondylitis will go away. Whether it will happen today? No. Why not? You have used your body. 50 years, 60 years, 40 years, doesn't know what. If you have abused your body for 50 years, at least give 50 weeks, or maybe get 50 days to work. Don't expect it in 5 days. Huh? From here you can do a little bit of an Ardha Matsyendrasana. From this one, you take your left foot, go to the next side. Your spinal twist. Left knee on the top, left hand goes to the back. Right hand will come up outside your left knee. Hand can be here, it can go down, but you can go very simply here, breathe in, twist your body to the other side. Half English, the lost in translation, called half Lord of the Fish pose, has no meaning at all. So that's what you learn. Release your hands, left hand comes down to the opposite side. This is a little bit of a difficult spinal twist. We'll do the easier one next. Right knee, right hand goes to the back. Left elbow comes outside your right knee. You can drop down to your, also it can go all the way down to your ankle. Breathe in, all the way down. Able to stay, very important. Relax your body, keep your feet in front. The easier one called Vakrasana. Makrasana is take your right foot next to your left thigh. Right foot high up, right hand goes to the back. Left hand comes outside your right knee, left hand goes touches your knee. Breathe in, turn your body to the right side. Able to breathe, able to talk, able to do all your activities. In fact, this is your relaxation. This is your savasana. You are completely relaxed in this pose. Hand gets released on the side to the opposite side. This is also called a piriformis relaxer. Piriformis is the muscle on which sciatic nerve is sitting. Left knee, left hand goes to the back. Right hand comes outside. Look at all the way to the back. Release your hand. Slowly come to the Sukhasana. And we'll do most important of the relaxer is relaxation of the back muscles. And the back muscle relaxer is your back bend on a mat. So we'll do about 4 asanas on the face down, which will be Makarasana, Salabhasana, Bhujangasana, and Dhanurasana. If you do unsupported back bend, it causes more tightness. Supported back bend. So on the mat, you get into face down. The first one is your Makarasana. We call it TV viewing pose. Put your hands here on the face on your hand, and you will be able to bend your knees with the breathing. All the feet down, breathe in. Breathe out, bend your knees as if you are trying to touch the hip with your ankle. So let's do it a few times. And you know, this is the way that children watches TV. Why? There must be a reason. They feel better. You know, there is something happens inside their body. That's why they do it. So remember, the back bend on a mat, the word is supported back bend. Okay. Drop your hands on both sides. Gradually remember, you don't need to do any savasana in between. You don't need to relaxation. Every relaxation. Bhujangasana. Hands on both sides. You get up into a cobra pose and able to stay in the pose. Very nice. A lot of nice cobras here, huh? Again, able to breathe. Okay. Come down now. Tirjak Bhujangasana. It's called your oblique. Separate your feet up to the width of the mat. Get into the Bhujangasana and look over your right shoulder towards your left foot. This is a part of called Sankha Praksala. Come down now to the opposite side now. Get up again, look over other shoulder to the opposite foot. Tirjak Bhujangasana. Okay. Come down slowly down. Keep your feet together. Hands under your thighs. Shalabhasana. Locust. Get your both the feet high up without bending your knees. And again, it's not how high you can get, how long you can stay in this pose. Back bend on the mat. Slowly drop your head down, bring your hands out, bend your knees. If you can hold both the ankles, get up into Dhanurasana. Sequence of events, these are called relaxation of your spine, spinal muscles and back muscles. Okay. Let's go now. Slowly turn on your back. And the way you do it in yogic, that you will be on your back, but head towards me, feet away from me. There's a reason for it. First of all, awareness will come to your body, that you will be able to do everything by listening without looking at me. Number two, in yogic tradition, you do not put your feet towards the person who is teaching you. Very important tradition, and we follow the tradition very much. But most important is the awareness. In a savasana or yoga nidra, basically you separate your feet a little bit, put your hands on both sides, palm facing high up, and just bring that awareness to your breath. Most important thing here is to do is that able to get into a relaxed position. If your neck has an issue, put something underneath your neck. Best thing is to have some folded towel. Reason for folded towel is that slowly you will see when improvement takes place, you'll be able to take it out. In a savasana, what you do, which you have never done before in your life, is called do nothing. Because you're always doing something. But in a yoga nidra, you follow your breath. Visualize your breath, take your breath in, and visualize your breath is coming out. The breath is the carrier of the life force called prana. In yogic healing, it's called pranic healing. You visualize the breath is carrying prana, bringing to the organ of disease. For me, I have a heart disease. I visualize it's coming to my heart. Call this pranic healing of my heart. If you have a back problem, you do your pranic healing to your back. You learn how to control your senses. Prattaha. You'll be listening to it this afternoon. Root cause of disease is the improper use of your senses. Learn how to focus. Enter into a state of meditation. When you are in a proper yoga nidra, all the physical and physiological changes have been seen called a relaxation response. The way the word relaxation response came up, the person who described it was called Herbert Benson in 1967. At that time, for the lack of proper English word, meditation word could not be used. It was a taboo. So the physiological effect of meditation was described as a relaxation response. The word is still being used. Slowly bring your awareness to your physical body. Move your toes, move your hands, move your fingers. And again, the best yogic gesture we've ever created. Take both the hands, rub both the hands together again. Rub it really hard, rub it really hard. Then put it over your eyes, put it over your face. Massage your forehead, massage your eyes, massage your face and head. Like American tradition called money back guarantee, this is a money back guarantee to improve your eyesight. If it doesn't happen, you come to me. I'll send you to all the famous yogis in this world. The first asana laying down is your Pavan Mukta asana. Bend your both the knees, hold into both the knees, bring it close to you. You can put your chin close to your knees. The chin can go in front of your knee. Somebody says, my stomach comes in my way, my chest comes in my way. I say, my mind comes in my way. Then you can roll a little side to side to see how flexible you are. and also can your move front and back. Beautiful. You can see any disease, any tightness, disease for the tightness, stress, insomnia, sleep apnea is going to run away from you. Drop your knees in the floor. Keep your knees bent. Put your feet together. Hands on both sides. Makarasana, spinal twist. Jatharguri Vartanasana, like a T. Hands on both sides like a T. Look into your right hand. Drop both the knees on the left side. And just close your eyes and breathe. In yogic tradition, you stay in one pose, you breathe in and out. In Vinyasa tradition, you go in and out with their breathing. In Iyengar, you stay in the pose with all the furnitures, all the blocks and everything, so you can see straps and blocks and stay there. This is the way the baby sleeps. So go back to the opposite side now. Look into the left hand, put both the knees on the right side. And stay there. Okay. Slowly come back in the middle. Keep your both knees straight. And you have seen we do very little bit of your Savasana and Yoga Nidra. Because this is your Savasana in yoga therapy. Keep your legs straight, hands on both sides. First one is your Pada Uttanasana. Both the feet, raise it at this 30 degree, not too high up, and able to stay there. It's not all the way high up. Utthita Padasana, feet raising pose. Follow your breath. When your breath will allow you, you will drop your feet down. Do not go against your breath. Breath is your sign of your imbalance to the physical body. Annamaya kosha to pranamaya kosha. Drop your feet down, slowly down. Next one is Padavritta Asana, feet rotation. Raise your right foot high up. Take a deep breath in, rotate clockwise 5 times, anti-clockwise 5 times. If you keep on counting, you will do the same thing on the other foot also. 5 times clockwise, 5 times anti-clockwise, but with your breath. Make a big circle. Be close to your neighbor. Your neighbor won't like you, no? You come close to them. There's a new term called partner yoga. You may have seen the partner yoga. Okay. Then you will do a little bit more difficult way. Next, once you've done that, you'll raise both the feet high up, and you'll do both the feet 5 times clockwise, 5 times counterclockwise. You think about your relaxation. This is all due to relaxation. It's not that how you're trying. It's all about your mind. Mind controlling Manomaya Kosha, controlling Pranamaya Kosha, controlling Annamaya Kosha. You'll be listening to Dr. Gupta about 5 Shik, Pancha Mahakosha, Vijnanamaya Kosha, Anandamaya Kosha. Dichakrika Asana or for cycling, very important yogic practice. Get a fit up and do it in cycling. But you find it out that people who do cycling do not develop any knee problem. Do cycling as if you're riding to the front, then do cycling to the back, very gently and effortlessly with your breath. So your breath will allow you, you will go down, put your feet down. We have a few more minutes, about 10-15 more minutes we have for the practice. Now we became a little bit of yogi and yogini. We'll be doing now a little bit of difficult asanas because we have overcome our heart disease. We have overcome all the disease we have. The first asana we'll do is your Setubandha Sarvanga Asana, bridge pose. Kept your knee bend, separate your feet until your shoulder distance. Raise your body high up. Put your hand on the mat and all the weight on the shoulder. Able to stay in the pose. Sanskrit name, Setubandha Sarvanga Asana. If you want to do one asana a day, that's the asana you do. If you're comfortable, you can raise 1 foot high up. See if you can get a one-footed Setubandha Sarvanga Asana. Then you drop your feet down, with the other feet high up, do the Setubandha Sarvanga Asana. And when you became like a yogi yogini from Portugal, you'll be able to get both the feet high up. Dr. Ava Gupta will be going to Portugal this June 21st, and she will see how they get both the feet high up on this position. Okay, drop your body down. Next one you will do, many of you have done. If you can do it, fine. If not, you can keep on doing a little bit of savasana or cycling. You will do a Sarvanga Asana. Your shoulder stand with the chin lock. Then you'll get into a plow, halasana. The way you do it, push your body all the way high up, and then body straight high up, touch your chin to the chest. This is called your chin lock with Sarvanga Asana. Then what you can do with the feet, you can do all sorts of things with your feet. You can do a Padmasana, lotus on a Sarvanga Asana. You can do Garudasana. You can wrap both the legs. You can do all kinds of things with the legs when your feet is high up in a Sarvanga Asana. And you can slowly come down as a halasana or a plow on the back and stay in the halasana as long as your breath will allow. These are little advanced poses, but these poses is again will come to you. You are not asking for them. They are coming to you. You come back out of the halasana when your breath will allow you. And from there, if you can try a little bit of a chakrasana or another full bridge. Put your hands in the back. Body will go high up as a cartwheel or a full bridge or bridge pose. Yes, put your hands on the back. Here she goes. Body goes high up. Beautiful. These are called anti-chiropractor asana. Huh? Beautiful. Chiropractor, need to see the chiropractor in town. Beautiful. You can come down slowly. And if you can do, I see a couple of good ones. Take it. Now see if you can walk on that hand. Becoming a Spider-Man or a Spider-Woman. Here is a Spider-Man coming. Okay, one more. Hands move. Move your hand. Try. It's coming. Oh, yeah. All right. Look at the Spider-Woman here. Very nice, you know. These are the ways you can control your body. Beautiful. We still have all the tension within us. Our tension will go away. Yogis give us all the tension relieving asanas. Tension relieving asanas are called Singhasana, and the Hasasana. You roar like a lion, you will laugh as much as you can. But before that, many of you can do, and all of us you can do, headstand. think about, as a yoga teacher, take this impression about headstand. Do not do a headstand. We don't want you to do a headstand. What we want you to do, keep your head down and feel what is happening to your body. The best way to do it is you sit down in a Vajrasana. You don't have to do everything. You sit down in a Vajrasana. You don't have to do a headstand. You learn. This is your stance. You put your stance here. Put your stance here, and then put your head down. You put your head down and don't do anything. If you keep your head down, keep your head down, and then when you get higher, what you do, you keep on walking. If you keep on walking, you will see what will happen to you. Your body is going to go higher. And again, what I really want you to do, I really don't want you to do a headstand. I want you to feel what is happening to your body. Your body will go high up. What will happen to you, your head is going to go high up, and you will feel the effect of it. Instability in your body. But other part is that you learn everything at any time. Example is here. She just learned it. And she learned it because she's 21. Or maybe 39. You know, he said, oh, don't do it when you're above 40. We said, we're all 39. That's when we can all do it. The one very important thing you will see that body has called proprioception. Proprioception means is a sensation, what you can do. But the sensation will be, you will fall down. You will never learn to walk unless you fall down. So what will happen to you, you will see, this is going to happen to you, which you will overcome. Look at that. That is a perfect headstand that is called beautiful. Proud of you. Okay? But you see, that's the time body gets into the pressure inside the leg, pressure inside the head, pressure is all equal. You know, this is called transformation. We know her for years and years. You know, she said, yeah, I'm going to do it. And that's what she learned. She's doing it on her own. She started with a little bit in the wall, a little bit in the chair. I just gave her a little encouragement, put her touch, so that what happened. So most important thing you will do, look at this. This is going to happen to you. Put your head down, you pull high up. Very simple. One thing will happen to you, you know, the moment you will do like this, put your head down, go down, you are not going to hurt yourself. The yoga injury, how many people know about yoga injury? How many people know William Brody? Anybody had read the book called Science of Yoga? He wrote a big New York Times article, how dangerous yoga is. And he himself is a yoga practitioner. So you talk to him, yoga is fine. He wrote a book. You are not going to hurt yourself when you pay attention to your breath. If you violate your breath, that's what she is going to talk about this afternoon, called Annamaya Kosha, the physical body, to Pranamaya Kosha. Any imbalance you do to this body, when you do a headstand, when you put your head down, first thing you'll notice, you're miserable, you cannot breathe. The moment your breath normalizes, body goes high up. In fact, the people who are doing it, he's doing headstand, he's doing headstand, she's doing headstand, when they headstand, they don't even know where they are. They have no idea what they're doing. They're in a trance. Any questions what we have done for the practice-wise? If you let us do, we are 24/7 yogis and yoginis. We'll be doing it continuously. You won't be able to stop us. Because this is see what will happen. Our finger goes in and out. This is called relaxation. When you're tight, finger won't go through there. They relax all the time. We get a saliva in our mouth. I've been talking all this time. I don't drink water, nothing. Parasympathetic activation. Saliva comes in. Okay. So, here is in the back, what you see. All the tightness has to go away. The tightness goes away with yoga say, with two things, two asanas, Singhasana and Harsasana. In a Singhasana lion pose, you will be roaring like a lion and we'll be videotaping all of you. And we'll put you in the Facebook and all the social medias. There's a question came up. All the recordings being done. All these things happening outside, somebody is recording with the cell phone cameras and showing, I cannot breathe, all these things happening. Now the police are getting counteracting too. Have you seen every police is getting a camera now? So they are also recording. It came to the Supreme Court. Can you record anybody without their permission? Said if you're in a private place or a public place, they can. So we're in a public place. We'll be all in the Facebook tomorrow, okay? Let's sit down in a Vajrasana first. You put your hands in front, separate your feet a little bit, you stick your tongue out, you roll your eyes high up, you roar like a lion for about 5 times, followed by laughter as long as you can. So stick your tongue out, eyes up. There is nothing called a fake laugh, we start doing it, you gotta make it stop, In physiology, there is an endorphin release, and laughter is the best medicine. Thank you for the morning practice. We'll be having a little lunch break, and I think I'll be here, we'll be doing question and answer. Pat has an announcement. I think the microphone is still live, Pat.